Greetings. My name is Sharon Ricks, and I am a member of the Bronx Alumnae chapter of Delta Sigma Theta Sorority Incorporated. Welcome to Delta Days in the Bronx. Our topic today is mental health and the impact of the COVID-19 pandemic on mental health. I am pleased to introduce Beatrice Coronel. Beatrice is the Executive Director of Haven. She is a leader in the mental health field and a suicide prevention trainer. She was born and raised in New York City and became interested in a career in psychology and the mental health field at a young age as a result of her lived experiences with racism, discrimination, and disparities. Over the past decade, she has developed mental health community-based prevention and intervention programs and initiatives for Black, Indigenous, and women of color of all ages and their families in an effort to decrease their risk factors while increasing their protective factors. Beatrice also serves as chair of the ad hoc not-for-profit committee of Bronx Community Board 12, where she aims to make a positive impact on the policies surrounding the quality of life for the residents of the community she lives in. Welcome, Beatrice.
Thank you, Sharon. I'm excited to be here for Delta Days, representing the Bronx, and happy that we are developing these communities that will produce the support that we need. So I'm super excited to be here. Thank you for having me.
Great, thank you. All right, so we can get started. We're going to spend about the next 30 minutes just talking about mental health and the impact of COVID-19 on our mental health. So let's get started.
Yes.
So we have been reading a lot about how the COVID-19 pandemic has taken a severe toll on mental health globally. But first, can you define for us what is mental health?
Sure. Mental health is the condition in regards to your psychological and emotional well-being. And so when we think of our mental health and our emotional well-being, we think of it from the perspective of how are we feeling? Are we stable? Do we feel unstable? Do we feel depressed? Do we feel that we are in a space where we need additional resources, supportive services? And for the most part, when we think of mental health, there's a stigma attached to it, right? And with the stigma, it's a negative connotation that has led us to believe that we shouldn't speak about it. We shouldn't seek supportive services. It's taboo to even talk about it, seen as a sign of weakness, when in reality, with all the different layers of stressors that we are all undergoing, especially with the pandemic, we should normalize that we are feeling overwhelmed and that we do need resources to process the things that we are experiencing.
Great, thank you. So the COVID-19 pandemic, as you just mentioned, has resulted in negative mental health outcomes such as depression, anxiety, and traumatic stress in people. So in your work, what are you finding people grappling with, as a result of this pandemic?
So when we think of people of color in general as the collective, prior to the pandemic, we were already facing a variety of disparities, discrimination, these systems that are oppressive, that aren't meant to have us lead successful lives, right? A lot of them are for-profit systems that don't aim to take care of our best interests or our needs. And so after the pandemic, there were even additional stressors that were added, more resources that we needed were not accessible to us. And so we didn't have access as it was previous to the pandemic to the services that we needed or the support that we needed. After the pandemic, it became worse. It exacerbated the issues that we were seeing. And so we saw that depression increase for many. People were isolated, they were feeling alone. I'll even talk about, when we think of the youth, the level of learning that they were used to became in a space where they were lacking what they needed even more. And so they were isolated, pressure was put on them, they weren't connected for us as humans, we need that interconnection with each other. And when we don't have that, it creates another level of stress. Economically, a lot of more families became impoverished because there was a lot of people were losing their jobs. There were a lack of resources for them. When we think of housing, a lot of people were facing eviction. The increase of domestic violence, we saw that there was a rise in that as well. When we think of mental health and we think of the way the healthcare system is set up, as it is, there was already a lack pre-COVID and pandemic. There was already a lack of access to mental health services. After the pandemic, it actually became worse. I know that there was an attempt to do telehealth services, but that's a hard way to connect. A lot of what we saw is that people that were in real need of these services weren't getting them. And so now we're seeing all sorts of issues that became worse because of the pandemic.
Thank you. I know you touched a bit about, and you talked about depression. And in October, new research from Boston University School of Public Health revealed the elevated rate of depression had persisted, of course, into 2021 and even worsened, climbing to 32.8%, basically affecting 1 out of every 3 American adults. Mm-hmm. And we hear a lot about depression. We now even hear it on TV. There are commercials about it and medications for depression. And I know there are different types of depression.
Right.
Can you speak to us a bit about the different types of depression and maybe the different types of treatments?
Sure, absolutely. And everybody's affected differently. And so, when we have a list of the types of depression, we have major depressive disorder, major depression, in essence, and it's also known as clinical depression. And it has intense or overwhelming symptoms that last longer than 2 weeks. And these symptoms interfere with our everyday life. Then we have bipolar depression. People with bipolar disorder have alternating periods of low mood and extremely high energy, manic episodes. And during the low period, they may have periods of depression and symptoms of feeling sad and hopeless. We have postpartum depression. We have something known as persistent depression, which is also symptoms can be a little less severe, but can extend for over 2 years or longer. So it kind of persists a little bit longer. We have psychotic depression. We have seasonal affective disorder, which is common for people to become depressed depending on the seasons that, for example, in the winter, it's darker days, we're more indoors. And so that affects us differently. But with the pandemic, we saw that at this point, it was not just individuals within the homes that were experiencing depression, but we saw it rise where the entire family units were experiencing depression. And so when we think of the head of households and the caregivers, if they're experiencing depression and they don't have access to process and receive the support to become more stabilized, how are they going to be able to care for their children, in essence, right? And give them the support that they needed. And with the pandemic, we saw that there was a rise in the entire family experiencing depression with no outlets to kind of like heal and process.
Wow. You just talked a bit about families and about their children, and like what are you seeing, particularly in the Bronx and in New York, related to mental health and our young people? They've had so much loss, right, over the past 2 years, and to be a young person trying to process as an adult. I know how difficult it was to process all of this. I can't imagine, a young person. What are you seeing, and what are some of your recommendations?
So when we think of the youth, right, their brains aren't even fully developed. They're still learning how to cope. And so I think that the important thing for us to think of, even when we think of the mental health care system, traditional talk therapy, that's what, maybe 45 minutes once a week. That's not enough for us to process, right? Like what do you really get into within 45 minutes? So we have to start thinking of non-traditional approaches to address our emotional well-being and address our mental health. And so non-traditional approaches are, what are your supportive services? And for example, what we at Haven focus on is how do we develop these impactful communities, right? How do we not just work with the individuals, but how do we change the systems that the communities are part of? And so with that, the non-traditional approaches is using things such as art, storytelling, music, movement, film, different ways to get not just the youth, the entire family units, adults, to process and express and externalize. When we don't do that, we internalize and depression becomes even more heightened, right? People are ready to implode. Here, you and I are in the Bronx, so we know that there's so much happening, but there aren't enough outlets for externalization and expression. And so we have to normalize that it is normal to be overwhelmed with all the stressors we have, which creates maladaptive behaviors. And we have to create these communities of pockets where they can feel not only uplifted, but connected, right? And that we're all in this together and that we're all fighting through this together. And so currently the way the mental health system is, there aren't enough resources. When we think of the providers, only 5% of the providers are women of color. That in itself says a lot, right? How are they culturally connected to our issues, and how are we processing systems of oppression and racism and discrimination? And so we have to develop, not only normalize for our people, but also develop these systems where they're not feeling shame when they're talking about their emotional well-being, where they feel connected and where they feel validated that it is normal for them to experience what they are based on all of the circumstances that we're experiencing.
Thank you. You know, you talked a bit about it just now and earlier, like how do we like lift some of the stigma around this? You know, people don't want to talk about it.
Right.
And we can't heal if we don't talk about it.
Exactly. And that's part of our culture, right? Like in my family, we were undergoing a lot of issues. There was a lot of domestic violence. I became interested. My interest in mental health was sparked because there was a lot of domestic violence and my mom attempted suicide, right? And nobody wanted to talk about it. Has she had these supportive systems and communities and collective where she can express, I'm experiencing this, and could have been validated and supported in many other ways, right? When we think of resources, a lot of us are in need of that, whether it's housing to relocate, whether it's funds to be able to move. And so just having someone that can listen, a community that can heal together is really the new, I feel like, our way out, our solution, right? Individually, isolated, it's going to be really hard for us to do it. Can it be done? Yes. But it's going to take that community effort to really get us all out of this hole that we're in.
So you touched on a really touchy subject for a lot of people, which is suicide.
Right.
And recently, I think I believe it was Naomi Judd who recently committed suicide. And then we hear about it because she was a public figure. But you know, after 2 decades of rising suicide rates in the United States, the numbers have declined a bit, you know, as of 2020 for the second year in a row, according to the CDC. Mm-hmm. But although the suicide rates have dropped, there was an increasing rate among young adults, mm-hmm. as well as American Indians, Alaska Native, Black Americans, Hispanic Americans, according to the CDC.
Right.
And you were a suicide prevention trainer. Can you just talk to us a bit about, you know, suicide prevention, and what we can do, you know, to help those who are struggling, who may be considering suicide?
Right. And actually the numbers have increased for Black and Brown Indigenous youth. And so again, when we think of the current way that our mental health system works, our healthcare system works, right? We don't have access to it, right? We don't have therapists available, even psychiatrists. The waits are long. The way the system is set up is typically you are institutionalized, you know, and hospitalized. One, that system doesn't work for everyone. And secondly, there aren't even enough beds at the moment, right? And so we know that that is not our solution. And again, I think that what we need to focus on is how do we create these extensions, like these bridges that are bridging us together, that when you think of suicide, someone who is at risk for suicide is feeling hopeless, isolated, and alone, right? And so how do we lean on each other and again, develop these communities where they have places to go and find that support and lean on each other? And so that's something that is missing. The way the US is very competitive, right? It's not community oriented. We need to be more interdependent of each other, and we're all experiencing things, but sometimes just sitting with each other is healing. And so developing more programs and organizations and outlets like Haven and others that are out there is important. That's really what's going to be like, whether it save you, it's, you know, it can save lives in essence. And so the more community-based programming that we have, the better our outcomes are going to be. This system is very competitive. And again, there aren't that many resources available for us, even in schools, whereas where the majority of the youth are spending time, we also have to think of our elders. The older we get, the more time we're spending alone, right? And so there's so many, and our program is multi-generational, because we understand that we need to think of all the different phases that we go through and how do we grow and learn with each other. And so the youth need that, people of all ages need that, and especially people of color. We don't have that. We don't have that many systems that are, again, that we can lean on. If anything, they kind of exclude us and screen us out, right? Even when we think of like schools being, you know, we're zoned out a lot of times. And so for me, this is why it is important. At a very young age, I learned that community support is where we're going to heal.
How do we do that? How do we build community support?
You're doing it, right? And
Okay.
even the way, by you inviting Haven to be part of this, that's how we do it, right? And there's also that competitive spirit. Sometimes I feel that we feel like we are competing with each other instead of working together. You and I already are forming an alliance, and the impact that we're going to have is going to be a higher magnitude than if we were doing this alone. And so for me, I see that, and my hope is that we begin to work together, because we're all focusing on different things. That if we come together instead of working in silos, this is how we're going to create that structure, that foundation that will hold us in moments of crisis. And so I think if you and I continue to connect and more people do that, and we continue to build on our connections and develop a coalition, we're going to be stronger. And that's what we don't have at the moment.
That's true. So as family members or friends, and we know we have someone that we love who's struggling, you know, with some mental health challenges, what are some of the ways we can support them?
Talking about it, normalizing, helping them understand. And again, that with all the added stressors that we're experiencing, when we don't speak about it, that's when we're going to see the risky behavior, right? And so developing this sort of like sanctuary of protective factors. For some, it may be connecting with someone, talking about it. But the reality is that, again, and I say this, you know, with a lot of sadness, that we can't just lean on the mental health providers or the healthcare system to get us out of this. We even have to turn this sort of into like an opportunity for education, right? We were talking about adults and the families that were experiencing depression as well. And if we don't help educate them, how are they going to be able to support their children? And so education is a big component of this, and normalizing and helping people understand what are some risk factors, what are some protective factors, what are some warning signs and symptoms, and to just help them, even if it's help them build the narrative of what to say, is important. For a lot of people, they weren't given a guidebook. These are not things that we learned in school. These are things that were stigmas, right? So we weren't talking about it openly as a family unit. If we start shifting the narrative in that way, where we openly talk about it with no shame, that's going to change the narrative for many of us.
So as a woman and as a black woman, we often hear, be strong, stay strong, strong black woman. And we sometimes ignore, our own mental health.
Yes.
What are some of the preventive measures that we can take to maintain our own mental health? Because we can't help other people if we're drowning.
Right. And that's why, for example, we offer bi-weekly community talks and gatherings where we're making that time for ourselves, right? And you're welcome to join us every 2 weeks. We have a therapist who comes on and talks to us, right? And we're talking together, we're uplifting each other. And one of the things that comes up frequently is what you said, we don't take that time for ourselves. A lot of us don't have that time, but if we don't make that time, it's going to actually be a disservice to us. And so we have to continue to find places like that where we can connect with others that are resonating with our stories, right? And that through sharing our stories, we're kind of like healing together. Because the reality is, as head of households, if we don't take care of ourselves, we're not going to be able to take care of our community, those within our households. And it's hard to find that as women of color. It is to find other women of color who can help us through this, who can understand our plight. And so this is why it is important that collectively we begin to build awareness for organizations that are like that are helping us, that are there and available to us. And so continuing to even encourage our youth to think of, when we talk about like career day, to think about careers in these fields, right? Life experiences is often what sparks our interest in these fields. And so we know that there's different ways that we can do it, and just how people have different learning styles. People have different ways in which they connect. And so finding that as adults, helping not only ourselves, but even our children figure out what are their kind of like interests in expressions, in being able to express themselves, and outlets for expression is important, right? We're like, what are they connected to? What is easier for them to kind of like help them in expressing themselves? So finding those outlets for each of us is important.
That's good to know. Can you talk to us a bit about, you talked about Haven.
Yes.
You can talk more about Haven and some other, resources that the community, especially in the Bronx, can look for help and support.
Right. And so I'm also part of my community board here. I live in District 12. And so my goal there is to also, currently I'm doing a assessment, a survey where I am wanting to hear from the people, what are their needs? And so mental health is something that was a big topic. And the goal is to then find funding to develop these other pockets where they can seek that, right? And so I think that the important thing for us to do now is, when we build community, in part of that is in hearing what are the needs of others, developing that trust, because unfortunately for many of us, we're kind of like disheartened with the way our government has been managing our needs, right? And so developing trust is important, and building that, again, impact. The more people are fighting for an issue, the better the chances are that we'll get our needs met and served. And so the important thing for me right now at Haven and being part of this community is to develop trust, assess what are the needs, and then develop programming according to those needs. But unfortunately in the Bronx, there aren't that many resources. That's the harsh reality, which is why we see a lot of people, again, with maladaptive behaviors. When we turn on the news and all the things, the atrocities that we're hearing and seeing, people don't have any outlets.
Right, and certainly the past 2 years have not made it, any easier.
It worse.
Yes, certainly. Thank you so much. You've given us such great information that we'll be sharing with the community, and hopefully this is the start of a great partnership.
Yes.
Are there any final thoughts that you want to share with us?
My hope and my goal is, again, that we let go of the shame, and that we allow ourselves the grace that we need, that with all of the stressors that we have. You know, and you said something earlier that really hit. A lot of times, you know, the cliche phrases of be strong, you're going to get over it. That doesn't work, right? Sometimes it's just being in the moment and understanding that I'm in a tough spot right now. I'm giving myself the grace to kind of like mourn and grieve, but then how do I connect with others to get through this? And so I'm hoping that my hope for our people is that we do find that connected space where we don't feel so isolated and alone, and that we feel stronger because together we're working for a better outcome, and more equity in all levels of our lives. And so I'm hoping that we can do that together. And of course, Haven is here for our Black and Brown Indigenous women. So please join us. We're here to support and help and shine and find pockets of joy together. But my hope is that others do find spaces like that where they don't feel so isolated and alone. So I'm hoping that people begin to validate their feelings and normalize that what we're experiencing is real, is not made up. We're not weak. We just have a heavy burden to carry.
Thank you. I like that. I'm going to use that, pockets of joy. And we certainly need some pockets of joy. So thank you, Risha, so much for participating and being with me this afternoon and being part of Delta Days in the Bronx.
I'm excited. Whatever you need from us, let us know. We're here and we're happy to now be part of your coalition and you're part of ours. Bronx Delta Days.
Yes,
all the deltas.
Yes, that is really great. Thank you so much.
Thank you. Thank you so much. This was a pleasure to spend time with you.
Yes, and hopefully people will watch this and connect with Haven and find those pockets of joy.
Thank you, Sharon. Be blessed.
All right. Thank you so much. Have a great afternoon, everyone.